Pause. Shifa. Maternity care, most affordable and compassionate, maternal health care in city of Bijapur.
Today, we are going to talk all about a really common condition in pregnancy called anemia. Now, I know that word can sound a little scary, but trust me, it's very manageable. Figuring out what it is and how to handle it is one of the best things you can do for a healthy, happy delivery. So, if you're pregnant, you know the feeling, right? Exhaustion is just part of the deal. But what if that deep, can't shake it fatigue is your body trying to tell you something a bit more specific? Let's get into what that might be. All right, let's dive right in. In this first part, we're going to break down what anemia actually is and, more importantly, what specific symptoms you should be looking out for, things that go beyond that normal pregnancy tiredness.
Okay, so what is anemia at its core? It's all about a special protein in your red blood cells called hemoglobin, or HB for short. You can think of hemoglobin as the oxygen delivery service for your body. When those levels are low, that delivery service gets sluggish, and that means less oxygen is getting to you and, most importantly, to your growing baby.
So, what's the magic number we're aiming for? Well, during pregnancy, your doctor wants to see your hemoglobin levels stay above 11 grams per deciliter. Your body is working so hard, making a ton of extra blood for the baby, so hitting this number is absolutely crucial to keep that oxygen delivery service running smoothly for both of you. Now, here's the tricky part. The symptoms of anemia can look a lot like regular pregnancy symptoms, but we're talking about a whole other level. Extreme tiredness, feeling dizzy just from standing up, or getting short of breath really easily. You might also notice your skin, lips, or nails look a bit pale. And there's a really unique one called pica. This is an unusual craving to eat things that aren't food, like ice or even chalk. If any of this sounds familiar, it's definitely time to chat with your doctor.
So you know what to look for, but why is it so important to do something about it? Well, this goes way beyond just helping you feel less tired. It has a real, direct impact on your baby's health.
And this, right here, this is exactly why we take anemia so seriously. For you, it can mean a higher risk of infections or heavy bleeding after delivery, which is known as Post-Partum Hemorrhage, or PPH. For the baby, the risks can include being born too early or having a low birth weight. It's pretty clear that getting a handle on anemia is one of the best things you can do to protect you both. Okay, enough with the problems, let's get to the solutions. Because the best news is that this is something you can absolutely take control of. This next section is your game plan, and it's built on two key pillars: what you eat and the medical support you'll get from your doctor. First up, let's talk about the most powerful tool you have right at your fingertips, your plate. You can literally use your meals as medicine to help build up those iron levels naturally. And the best part is, these foods are all around you. We're talking about things like spinach and other green leafy veggies, fruits like pomegranate and watermelon. You can even make a simple switch and use jaggery instead of sugar. And if you're a non-vegetarian, red meat and liver are total iron powerhouses. Now, here's an amazing pro tip that's like a superpower for your diet. The iron you get from plants needs a little helper to get absorbed properly, and that helper is vitamin C. It's as simple as squeezing some lemon over your veggies or having a glass of orange juice with your meal. That small step can make a huge difference in how much iron your body actually uses. Just as important as what you eat is when you eat it. Tea and coffee have these things called tannins that actually block your body from absorbing iron. So the rule is easy. Just wait about an hour after a meal to have your cup. The same idea applies to your supplements. Calcium and iron kind of compete with each other, so it's best to take them at different times, like one in the morning and one at night. Now, while a great diet is your foundation, it's often not quite enough to keep up with what your body needs during pregnancy. And this is where your doctor comes in, and their advice is absolutely non-negotiable. You have to follow their prescription. All right, so your doctor has prescribed iron tablets. Let's break down the best way to take them. Ideally, you want to take them every day on an empty stomach to get the best absorption. Now, you might notice some side effects, like a little nausea or even black stools. Let's talk about that. This is so important because seeing that can be a little alarming, right? But it's totally normal. In fact, it's a sign that your body is absorbing the iron, which is a good thing. If you're feeling nauseous, you can try taking the tablet with a small meal. But whatever you do, please don't stop taking them without talking to your doctor first. Sometimes your doctor might suggest other treatments too. For example, they might give you a deworming tablet because some parasites can actually cause iron loss. And if your hemoglobin is really low, or if you're getting close to your due date, they might recommend IV iron. This is just a safe and super fast way to get your levels up so you're strong and ready for delivery. So we've covered the what, the why, and the how. Let's bring it all home and talk about the final steps to get you to the ultimate goal, a healthy mother and a healthy baby.
Okay, this is really, really important. These are the red flags. These are the symptoms that mean you need to go to the hospital right away. No waiting. If you feel severely out of breath, even when you're just sitting down, if you have any chest pain, or if you feel so dizzy that you think you might faint, it's time to get medical help immediately. I think this quote from Dr. Salma Attar, whose expertise really guided this explainer, just says it all. A healthy mother means a healthy baby. It's a beautiful reminder that when you take care of yourself, you are taking care of your baby. Those little things you do every day really do prevent bigger problems down the road.
So here's the bottom line. Anemia in pregnancy is common, but it is so manageable. By just being aware, making a few simple tweaks to your diet, and listening to your doctor, you're taking powerful steps toward a healthy pregnancy and a safe delivery. Remember, you're in control. You've got this.
Shifa Maternity Care, Dr. Salma Attar. Appointment call 243761.